On this episode of Putting Possibility into Practice, we're catching up with a customer in Katy, Texas, here about the long history of Medical Colleagues of Texas and all that they're doing in the Katy community to provide and enhance great patient care each and every day. This is Putting Possibility into Practice, and it starts right now. I'm Joe Agustinelli, Social Media Manager at Greenway Health, and this is another episode of our podcast, Putting Possibility into Practice. If you're a returning listener, thanks for returning, and if you're a new listener, I invite you to subscribe to our podcast on your platform of choice and get notifications when new episodes are uploaded each week. And on this episode of Putting Possibility into Practice, as I mentioned, we're talking with one of our customers in the Katy, Texas area, about just a little outside of Houston. It is Medical Colleagues of Texas. Ethan Bing is the practice administrator, and he is here on this episode. First, and I will be 100% honest, I know people can't see it, but we're actually on location in Katy, Texas. So we've broken out of our normal podcast studio in Tampa, Florida, and are in Katy, Texas. So first, Ethan, thanks for having me in the practice.
Certainly. I appreciate you coming out to meet with us today.
And Ethan, for our listeners, talk about, there's so much history here, and we'll get into that throughout this podcast, but talk about Medical Colleagues of Texas, where you guys exactly are located, the services you provide to the community, providers, and the reach of the practice.
Yeah, so we're one of the original practices out here in Katy, Texas. We're about 30 miles west of Houston. And we've been in the area, or at least the greater Houston region, Texas region, for many, many years, dating back to the early 1900s. My great-grandfather and one of our other physicians' great-great-grandfather took care of patients going around on horseback to do surgery on patients' kitchen tables, all the way up until today, where we have 11 physicians. We've got about half primary care. We've got pulmonary disease, gastroenterology, and OB-GYNs here in our practice. Some of our primary care physicians take care of the Katy ISD football teams and other sports players, and it's been a great way for us to engage with students, with teachers, with coaches, and just give a little back to the community.
And such an integral part of the community. And I was, when we had talked before we started recording, and as I was on a tour of the office earlier, we talked about some of that history, and I alluded to it in the introduction. But early 20th century, it's amazing to hear that story about caring for patients on horseback and then surgeries on kitchen tables. Obviously, healthcare has evolved since then, and how has MCT stayed on top of the ongoing changes in healthcare?
So we originally were, of course, our physicians took care of patients without charts, without records. And then I'd say the general ledger became the main record-keeping source. But that started off with just listing office visit and maybe 50 cents or $1 as the charge. From then we went to paper charts, of course, and then we had medical manager back in, I believe it was the late 80s or early 90s, when we needed to start sending electronic claims to insurance companies. From there, we looked at getting a different medical record system, a complete package. I would say it was about 2008, and we found Intergy as one of the best options because it had all of the EDI capabilities that we needed, plus the billing records that would come right over from medical manager. So it was really a win-win there.
And obviously you've seen the evolution in healthcare, and talk a little bit about that family history. We mentioned you're the practice administrator, and what are all the family ties from way back in the beginning of the 20th century to where we are today?
So it's really hard to list them all. I actually learned a bit about our practice this morning that I never expected. As I mentioned, great-great-grandfathers were taking care of patients back in the early 20th century. My grandfather, a great uncle, of mine, my father, my uncle, and my aunt have all practiced and are still practicing as well. But our other physicians have long history too. A fun one is one of our OB-GYNs here. Her mother is a pediatrician in the nearby area, and different family practice doc here in our area saw her when he was a kid. We've got a ton of staff that actually knew my grandfather before he passed away. I never had the chance to meet him. So it's great hearing stories both from staff and patients alike, about all that history. One story that I'd love to share is my uncle used to work for my grandfather back when he was a kid, and he was told that he would make 50 cents an hour if he did not wear a tie, but he would make 75 cents an hour if he did. Sure enough, he didn't want to wear a tie, but he was still forced to. And when I was working here in high school, filing charts before we got on the Intergy platform, I came in shorts and flip-flops one day, which was not a good idea. I got sent home, and so the rest of the week I ended up wearing a 3-piece suit just to poke back.
You got sent home, but their family lineage here. How do you get sent home?
Working for family, they can be the toughest on you, but it's the most rewarding.
And we touched on it a little bit. You talked about medical manager and then the transition over to Intergy. Talk a little bit about your partnership with Greenway Health and not only the product solutions that we partner on, but how it has enabled the practice to expand its offering and grow to the point where it is today in 2019.
Certainly. So I would just say that what's been great about Intergy in the time that I've been with the platform, it's probably been a little over 6 years, is the slow but continuous upgrading of the system. I find Intergy to be incredibly robust, have really good systems that are in place for you to get tasks accomplished. But in addition to that, there's constant continuous upgrades as times change. The meaningful use reporting systems, all of those new tools that have come out in the past years, they've been great. And then in addition to that, the community partners have allowed Intergy to take an extra step forward in the accelerated innovation. One partner that we've partnered with is UpDocs, which is a messaging system. So instead of us calling all our patients for reminder calls, we now can send out text messages. And ironically, we were so afraid that people would be resistant, but I can't tell you how many of the older patients even still prefer text messaging. So it's been great. One big benefit that we had was back during Hurricane Harvey, our office had to shut down for a week because most people were flooded and not able to get in. And we were able to utilize that blast notification to redirect our patients and to cancel and reschedule appointments. The Memorial Day flood just a couple months or a year before that, we had 3 or 4 people calling from cell phones on schedules to get patients rescheduled, and it just didn't work as well as it did with UpDocs. And then one last really important story is we actually had a data breach when we had our system with our servers in-house, and Greenway actually took us from a in-house server to IOD within about a week's time span, which was absolutely incredible. We had constant contact, and just the conversion time and the downtime was just incredibly short, and it has allowed us to outsource a lot of our security needs, which, as most practices are in these days, not capable or have the resources to afford such robust security systems. So IOD has been absolutely great.
What advice would you give a practice who may be considering going from that on-premise to hosted service? I mean, it sounds like you guys are really impressed with not only the process but the decision to do so.
I think one relatable experience for most people is the conversion onto an EMR or onto a different EMR. And I'd say take that and divide it by 100. Really, it's pretty seamless in the way that they can back up your current system and push it onto the new one. Sure, there may be local systems, local domain systems that need small tweaks, but in my mind, it's a 2-week process, not a 2-year process or a couple month process. It's really it's a pretty easy conversion.
So looking back now, I mean, it's over 35 years of this practice. What lies ahead, in 2019?
It's really hard to say. We've grown slowly and organically. A lot of our doctors have come in as as friends, as family. They've come in with the idea that they want to practice medicine to take care of the community first. And so with that, I think we'll just see a continuous, slow, organic growth, possibly with the addition of another primary care physician in the end of the year. And then, of course, we're looking to switch on to the new portal that Greenway has to offer. We find that the tools that it has are much more robust than our current portal. And we look forward to being able to streamline our registration and check-in process through that system.
And when we talk about emerging, patient trends, something like that upgrade to the portal, how much of that is in response to the changing nature of the healthcare industry and more of an on-demand type of system from consumers?
It's incredibly important. I think patients need to have the ability to contact their healthcare provider outside of business hours. And I think we need to even push that to say that a lot of people need healthcare outside of their work hours. So we've considered even having scheduling staff or medical assistants on call, so to speak, or available to answer calls over the weekend. But when you look at it from an operational and a financial standpoint, it's a much better investment to use a platform that patients can communicate with us through the internet and not through the telephone, because that's obviously the direction we're headed.
And we talked about even in a disaster situation, how important that is in a city like Houston, and where we are based in Tampa. We're prone to it too with major storms. How important is it to have a system like that in place?
Yeah, it's incredibly important. I laugh at the thought of what happened before electronic medical records existed. And it just makes you realize as well how much more we have to go. But it's a huge step forward. I'm really looking forward to getting it set up and to have a new push to get all of our patients and all of our providers engaged.
In addition to the emerging trends in patient engagement, what else is on the short-term radar of the practice for emerging trends as we continue on to 2019?
I think taking advantage of the big data that is at our disposal is key in terms of our transformation. Honestly, with the data capture that electronic medical records give us, coupled with the reporting tools that we have at hand, we have a long way to go to truly master effective practice with those tools. With the new innovative payment models that Medicare Advantage, and other commercial plans are pushing out, we have a lot of flexibility to try and to do interesting things for our patients. So I'm really excited to be here in this time of medicine, and I hope that we can do our best to take advantage of that and take care of patients even better.
And we look forward to continuing our partnership with you guys to help you achieve those goals and to enhance patient care here in the Katy, Texas area.
Thanks, Joe. Here's to another 10 years.
We'll get together again to talk about future growth, I'm sure, on future episodes. So I want to thank Ethan Bing. He is the practice administrator here at Medical Colleagues of Texas, my guest on this episode of Putting Possibility into Practice. Thanks, Ethan, for taking time out of your day to join me.
Thanks, Joe.
And a reminder that you can also subscribe to our podcast, get notifications of future episodes of Putting Possibility into Practice when they are uploaded to your podcast platform of choice. And in addition to finding the podcast on our website, you can also see the product solutions and learn more about Intergy and Intergy Hosted and some of the other solutions that we talked about on this episode of Putting Possibility into Practice. You can find all that on our website at www.greenwayhealth.com. I'm Joe Augustinelli, the social media manager at Greenway Health, and thank you for listening to this episode of Putting Possibility into Practice.